Many of you have probably heard about patient assistance programs through a company called the Partnership for Prescription Assistance, who has Montel Williams as a spokesperson. Well, how are they different than SCBN, Prescription Advocacy? There's a lot of things that SCBN does that Partnership for Prescription Assistance does not do. Yet Partnership for Prescription Assistance is a great company that's raised awareness of patient assistance programs phenomenally. But what are the differences? And should you choose Partnership for Prescription Assistance to help you, or should you choose SCBN? Brad explains the difference in this next part of our interview.
Tell me, you talked about we charge membership dues. And of course, you know, it's obvious that we have operating expenses. We go to great lengths for our patients. We do a lot to fight for our patients and to make sure no matter what problems come up that they get their medications on an ongoing basis. A Partnership for Prescription Assistance, they do what they do for free. Tell me what's the difference in what we do and what the Partnership for Prescription Assistance and their spokesperson Montel Williams does.
Well, Montel and the Partnership for Prescription Assistance, I think they're wonderful. They basically operate as an outreach program to explain to the millions of people, literally 40+ million people in this country, that these programs exist. But what they do ends with sending you the paperwork. That's all they do. They don't manage or upkeep your account. They don't take care of dealing with all these companies for you. They certainly don't enroll you. All they do is send you the forms. They leave everything else to you. So whereas what they do is great is an outreach program that's great for the people that can do it on their own. That's wonderful. However, we help people that can't do it on their own. We do everything that Montel and the Partnership for Prescription Assistance does not do. We take care of the refills, we get them enrolled, we handle all the problems in between, anything that can come up, from medication being misplaced to possibly being denied by the pharmaceutical companies themselves, and we'll appeal their decision to see if we can get the company to overturn its initial denial to put them on the program. Whereas Montel and the Partnership for Prescription Assistance assist with outreach, they do none of this. All they do is explain how to get on programs, and they give you the forms. But their assistance ends there. They have a customer service department that'll help you get forms, but their customer service department ends there. Our Department of Advocates, you can call 8 to 5, Monday through Friday, assists with everything else, making sure we get you on the programs. That's our only goal here, making sure you not only get on the programs, but you keep getting the drugs. And if there's problems, say you're audited by the companies, or a medication is misplaced en route, we solve these problems for you. The Partnership for Prescription Assistance does reach out, and it helps millions of Americans understand these programs exist, but that's all they do. We take care of everything else. We manage the accounts of people who absolutely need the assistance to get on these programs and stay on these programs for the drugs that they need.
So I call Montel Williams or the Partnership for Prescription Assistance. What do I get?
Well, you get a light amount of assistance, assisting you basically in, one, getting the forms to basically apply for the programs. But that's what you get. You get their assistance getting the paperwork. But that is all. They do publicize the fact these programs are out there. It's great. It's an outreach program only. But they do give you the forms. But at the end of the day, that's all they've given you.
And I call Select Care Benefits Network. What do I get?
Well, you get a whole lot more, actually. You get a group of people who, one, make sure that you pre-qualify for these programs. They make sure you're actually on them. We walk through the processes on the phone with you. We walk through literally your entire personal situation to make sure that you can be on the programs that you need to be on for the drugs that are available out there. We then take care of making sure you get the proper paperwork, you get it back. We take care of making sure that it gets to the company complete, and we make sure that it gets processed properly. We solve all problems in between, and then we manage your case on a month-by-month basis, week by week as well, to make sure that any problems that arise we take care of, and we make sure your medical supplies continue to flow to you.
So what kind of problems do you take care of? Just give me a list of them.
Oh, there's a ton of problems. There's a ton of issues. Think about it. When you're dealing with 260 bureaucracies, all of whom do business differently, sometimes all the way down to different medications being handled differently, we can deal with a vast assortment of problems. Take the medication Keppra. Keppra has a specific diagnostic code that has to be used. One of the massive problems that occurs with Keppra is most doctors, and it's prescribed, by the way, for epilepsy or seizures, most doctors are prescribed for dozens of different reasons that relate to epilepsy. But what's interesting is that that company will only take one diagnostic code for partial onset seizures. If you put straight epilepsy on the file, they'll deny you. but we understand this. That's why we work with doctors immediately to make sure that they put the proper code to begin with on there. That way they can get the meds without having to appeal and be denied. There's a bunch of other medications that have similar issues to this, some not quite as nuanced.
So you actually tell doctors what kind of codes to put on the application forms?
Absolutely not. We explain what codes are acceptable. If the doctor finds that the patient falls under that code, then the doctor can use the code and the patient can get it. Otherwise, the patient simply cannot be on that program. It's very unfortunate, but the program has strict guidelines.
Okay, so you just work with the doctors to make sure that the right code that they put on there is on there. You don't tell them what to put on there.
Well, absolutely. We don't just write codes on there. We're not doctors. We don't prescribe medications, and we certainly don't prescribe the medications or why they're given to a patient. We only assist patients getting the medications. But what we do also is we assist doctors and our patients, and their patients too, understanding the unique nuanced issues relating to every program. We work with them to make sure they understand the complex issues that are involved with these medications, especially with something like a rule when it comes down to a specific diagnostic code. We help them understand that that is what is necessary. If it's something they wish not to use, then indeed, or something they feel that doesn't apply, we simply must try to help let the doctor know what alternative medications are available so the doctor could perhaps pick a different medication for the patient to be on.
Okay. I remember one case recently, a doctor put on the form, he put seizure disorder.
Yes.
But the real diagnosis was partial onset seizures.
Yes.
Right. And so that was what the patient really suffered with, partial onset seizure, but he put a vague code on there rather than the real code for the specifics, because that drug is only available for that. And that's the kind of situations you're talking about?
That's exactly the situation I'm talking about. In that case, the patient would have been denied. If a doctor writes something vague and the company requires something that's very specific, then unfortunately the medication will be denied. At that point, we can work with the doctor's office to understand what would be necessary if he chooses that is, of course, the proper diagnosis. However, if it's not going to work, it's not going to work.
So a doctor's office can actually, there's two different diagnostic codes that he can put, and both of them are right.
Yes, dozens in fact. There are dozens of diagnostic codes, and we're only talking about one program.
For one disorder.
For one real disorder, yes. There's dozens of different diagnostic codes. One is specific that the company accepts. The others, whereas that's exactly what the medication's for, they don't accept those codes. As a result, even though it's the same overall syndrome of suffering from seizures, epilepsy, seizures, partial onset seizures, they really all come back down to the fact that this patient suffers from seizures. And the reality is the company accepts only one code. Luckily, they'll take an appeal. We can appeal their decision. So if someone was to put down something like epilepsy now, we could appeal it. Unfortunately, it increases processing times because then we have to deal with the company and write a specific appeal letter and specify, I know you only take this one code. However, this is a similar code that really means the same type of thing. And this is what the drug is actually used for. And in that case now, that company will accept those types of appeals. But before that, no. It makes things very difficult. It's another reason why we're so necessary, because we understand the rules and the guidelines all the way down to such a minor point. But let's be honest, these minor points mean everything. A minor mistake, such as not checking a checkbox on the form, can lead to the patient being completely denied, and a denial can lead to waiting for weeks, maybe another month or two to get that medication. Imagine a person that has seizures, grand mal seizures, or basic epilepsy. Imagine them doing without that drug for a month or two. Imagine how scared they are.
And the same thing can happen for someone who has blood pressure disorder, a cardiac patient, someone who, without, maybe it's nitroglycerin you're getting or something like that. They got to have that in case they have a heart attack to live. Or if they don't take those medications, then they could have a heart attack. If they go without their medications,
they could wind up in the hospital. So yes, these nuanced issues that the companies deal with, these bureaucracies, they take only specific information. If something is wrong, then they can deny for any reason really. If anything is out of place, this is why, or if any rule is not followed, this is one more reason why we're here to help the people that cannot handle these processes themselves, to make sure that they continue to get the medications and to make sure they stay on these medications ongoing and they continue to receive their supplies, if someone doesn't take their blood pressure medications or their seizure medications, their cancer medications, they can wind up in the emergency room or worse. And remember, these are uninsured patients. What do you do when you wind up in the emergency room with no insurance? Imagine not only the medical bills, but just imagine your health. What puts you there? You're in a lot of trouble if that happens. We make sure that that doesn't happen.